Hi sir, we are from Medgate today and I have a few questions for you.
Please.
Sir,
Few questions. You should ask more questions.
oh, okay sir. So sir, how do you define diagnostic excellence and what are the key metrics one should take care in healthcare system to measure it?
You see, diagnostics is the super specialty subject. I'll tell you why. We think in hospitals, neurologist or orthopedician or a gynecologist or a cardiologist or super specialist. Who is advising them? They will not touch the patient unless they get the report from the laboratory. Therefore, the advisors are laboratory people. Therefore, laboratory is a super specialty. I tell pathologists or biochemists or microbiologists, whomsoever it is, you must hold head high because you are the advisors. Number two, who is examining the patient? It is not the clinician. Clinician is testing the patient to see whether such and such a disease exists or not. Who is examining the patient? Who is examining the urine sample? Who is examining the tissue? It is the laboratory people. Therefore, laboratory does the examination, pre-examination, examination, post-examination. And who is using this data? The clinicians to test the patient. This is now. The laboratory plays a very vital role. Most three important things. Only what is required to be done. Number one, unnecessary test should not be done. Examination should not be done. Today I see in many places 999 rupees, 450 tests and things like that. Are all this examination required? What? Doing right thing at right time for the right purpose is the quality. Laboratory has to do quality work. That's number one. Number two, the cost should be affordable because more than 90% of our patients, they have to pay out of pocket. Therefore, the insurance agency should come into picture. For example, I'll tell you, lead toxicity. We don't have facilities. Cost is very high. We should bring it down because people who get lead poisoned are poor people. They cannot afford to pay. Cost is second thing. Third one is delivering the report on time, which makes clinicians to take immediate action to prevent further, damage to the patient. These are the three important things I feel is required as on date.
And sir, what are the biggest barriers in achieving the diagnostic excellence in critical practices today?
The biggest barrier is lack of awareness, lack of trust and faith in laboratory, because people think whatever they are doing is not used for my treatment. They think it is for the business. These are some of the challenges. This is one of the barriers. The diagnostics institutions must convince that what is required is only done here, not unwanted stuff. And the clinical challenges are the clinician must use this diagnostic tool results to make patients better. This is a very important thing. Sometimes the hospital patient gets discharged. After they get discharged, the reports come to their ward. This is also happening. There is a good coordination required between diagnostics, other healthcare sectors. Good coordination is required.
And sir, how is AI transforming diagnostic accuracy and what are the risks over reliance on technology?
In fact, there is no risk. Actually, AI is going to reduce the risk to the patients. Today, 50% of the risk to the patient is from the laboratory. This risk can be covered when human errors are avoided. Artificial intelligence will bring down the human error. With automation, human errors are reduced. This is one advantage of it. What are the challenges is the cost, technology cost. Okay, now if few customers are there for AI, cost will be very high. Like when cell phone came, it was very expensive. Today, cell phones are affordable by vegetable vendor also. Similarly, over a period of time, I'm sure with every healthcare sector, utilizing the artificial intelligence-based technology, the cost will sure to come down. And more than any of these things, I always believe that we need to look at one health. It's not just the human health, human diagnostic lab. We have to look at animal health because if animal is sick, man becomes sick. If environment becomes sick, man becomes sick. If agricultural produce has lost a pesticides, insecticides, our life will be at threat. Therefore, we need to integrate not only various types of medicines like Ayurveda, Unani, Siddha, and allopathy. We have to integrate various other health disciplines like veterinary health, agricultural health, human health, environmental health, so that even without examining the patient, we can predict what is the level of lead or cadmium, mercury, or pesticide in the blood if we know what he is consuming, where he is living.
And so, what are the key strategies healthcare providers can use to communicate this uncertainty to patients related to diagnostics?
One is public awareness. Public is not aware. Number two, assurance that yes, we have created awareness, you are coming, we assure you that you will be protected from such and such a problem. Like for diabetes, like simple lifestyle is an advice. The third one is providing an opportunity. Because rural area, 80% of the population, where will they go for we need to provide them the mobile laboratories. The mobile laboratories will solve most of the problem. They don't have to travel to far off places. Project 797 will be launched very soon. What is this Project 797? 797 districts are there in India. Every district will have a district hospital. It has. Every district hospital should have a unit to take care of whatever I mentioned.
Thank you, sir.